Hi everyone, welcome to this episode of Mary's Health Chat. It is time for some health chat. Let's discuss health. Our topic of discussion today is osteomalacia. Let me properly introduce myself. My name is Nurse Merit Romanus Amarachi Merit. Now let's dive into why we are here. What exactly is osteomalacia? Osteomalacia is a condition or a disease that is characterized by the softening and the weakening of the bone caused by inadequate metabolism of some minerals due to inadequacy of calcium, phosphate, and vitamin D. When this happens to a child, it is called rickets, juvenile rickets, fasciitis, anyone you want to call it. But when it happens to an adult, it is called osteomalacia. Like I said earlier, this is often caused by deficiency of vitamin D. Vitamin D helps to absorb calcium in the body, and calcium itself helps in the strength and the hardness of our bone. Note that low level of calcium in the blood can lead to osteomalacia, which I've explained as the softening or the weakness of the bone. And what is causing this is whenever there is low blood calcium, this means that there is low level of vitamin D that are produced by the skin when they are exposed to sunlight, or they are absorbed by the body through food. That means there are two sources of getting vitamin D: the one your skin traps from the sunlight and the one you consume from food. And it's often gotten from animal food like milk, animal products, milk, meat, animal food. Mention them. That is where you can get vitamin D from, because this animal also gets vitamin D from the sun. Okay, then there's another thing I want to discuss with people that are prone to vitamin D deficiency. Let's get to know what condition can predispose you to vitamin D deficiency. The number one condition that can predispose one to getting vitamin D deficiency is when the person lives in an environment or a climate that have low sunlight. That person can be predisposed to low vitamin D because there is no sunlight that the skin can trap vitamin D from. And the next one is people that stay indoors. When you stay indoors often and on, you don't get enough vitamin D. The third is people that walk indoors during the daytime. These are some of the people that suffer from deficiency of vitamin D. Another one is people that always wear clothes that cover their whole body. How then can your skin trap vitamin D from the sunlight? The next is people that have a very dark pigment on their skin. That dark pigment stops your skin from trapping vitamin D from the sunlight. The last and the most important point I want to drop here: people that use heavy sunscreen. Have you seen it? Everything that has an advantage also has disadvantage when you misuse it. So when you use a heavy sunscreen, there is a consequences for it. That's deficiency of vitamin D, because your skin is now unable to trap vitamin D for the sunlight. All right, there are some conditions or diseases that I would like to discuss. Let me call them conditions because they are actually conditions. There are some conditions, health conditions, that can also predispose one into having osteomalacia. And number one health condition that can predispose you into having osteomalacia is cancer. Cancer reduces the level of phosphate in the blood, causing osteomalacia. Another type of cancer that can cause osteomalacia is the cancer of the thyroid. You know that thyroid gland also helps in controlling the level of calcium in the body. Both the thyroid and the parathyroid gland helps in doing this. So when it is affected, when there is cancer of the thyroid gland, it can also lead to osteomalacia. The next one is kidney disease. Anyone that has kidney disease is also predisposed to having osteomalacia. The next is liver disease. If you're suffering from any liver disease, you can also be predisposed into having osteomalacia. And last is side effect of some drugs, especially those drugs used in treating seizure. can predispose one to having osteomalacia. Now, let's talk about the signs and symptoms of osteomalacia, what you notice in yourself or in another person to know that they have osteomalacia. Number one is muscle weakness. Number two is bone fracture, especially without injury. Number three is numbness around the mouth. And when you notice it, this is a sign that there is low calcium in your blood. When you feel some numbness around your mouth, it's a sign that there is low calcium in your blood. Number three is widespread bone pain, extreme pain that is widespread in all your bone. The last one is you might feel some spasm or cramps around your arms and your feet. These are the signs of osteomalacia. Now let's discuss the remedy to this osteomalacia. With all this explanation that I've done, I think you've already got to what the remedy is. The remedy is the intake of calcium, the intake of phosphate, the exposure to sunlight so that you will trap vitamin D, or that you take supplements. You take calcium supplements, or you take phosphate supplements, or you take vitamin D supplements in their right proportion. This is the remedy to osteomalacia. Right? Also taking analgesics for pain relief drugs. Make sure you take some supplements. Make sure you expose yourself to sunlight. Make sure you eat food that can feed your body with enough vitamin D. Thank you all so much for being with me in this episode of Mary's Health Chat. I know you were able to grab a lot. Thank you. I want to play with you guys too. Don't forget to subscribe to our YouTube channel at Mary's Health Chat. Don't forget to follow us on Facebook. Don't forget to drop your comments. Don't forget to share our videos to your family and friends. If there's any question you want us to attend to, please drop it on the comment section, or you can DM us directly. Thank you all so much for being with us. Thank you for being part of this episode. See you all next time. Bye for now. Bye.